Quite often, I think maybe all women, I don't know the statistics, I'm not a professional in this area specifically, they feel this separation of the muscles here on the belly. And sometimes, at least I can recall my own experience, it was like, oh my God, is it going to close? So what is this, and is there anything that could be done about it?
Well, it's called diastasis. The fancy name for it is diastasis recti, which is indeed the separation of two abdominal muscles, the recti abdominis, and also the line that is in between them, the connective tissues, is overstretched. Well, to some systematic reviews, so it's a collection of research, it says, the number very variable, between 56 to 100% of women will have some sort of separation towards the end of their pregnancy. So up to 100%. Depends on how big is the belly, the woman's frame. Also, if you have multiple, babies inside, definitely your risk is higher up. I would not worry about it and assess it straight after giving birth. So if you gave birth like 3 weeks ago, even like a month ago, do not panic if you still look 3, 4, 5, 6 months pregnant, and if you have a belly, and do not panic yet. Sometimes diastasis recti is obvious during the pregnancy. So when a woman goes up, like an abdominal curl, there is like a triangle shaped, so it's quite an indicator. After that, after you gave birth, you finished your postpartum bleeding, then you can start looking into, do I have a diastasis? Do I have a separation? Most of the common symptoms of diastasis is a belly that, even if you try to pull it in, doesn't go away. You can actually feel the opening in the gap. Many women experience problems with their bowel movement because obviously there is no support through the tummy. Some will experience back pain, some will experience incontinence, and many other symptoms that might not be so obvious, and even some will have a hernia around their belly button. So I would always say this is the problem that needs to be addressed with a professional that has experience in it, that knows how to work with it.
Thank you. Is there anything else a woman should know about in correlation to the separation of muscles before they come back to their regular routine exercises?
Well, usually because diastasis recti is a certain medical condition, I wouldn't say that, hey, go back to your routine and do what you did before. It needs a special treatment, special approach, special exercises. So definitely do not run back to your routine before you check it and before you get it under control and before you modify it. And the very first step, how you can start it, is to do a self-check and self-assessment, which I will also show you. This is video about diastasis recti self-assessment. And I will now show you a simple test that you can use at home yourself to assess yourself for presence or absence of diastasis recti, and what you need to look at and pay attention. Of course, it's always better if a healthcare professional that is experienced and trained in diastasis recti also assesses you at least once after birth, but so that not to panic where you don't need to panic, or pay attention to your body. I will show you this self-assessment. First of all, you need to lay down nice and comfortable. We are looking at the area where zygote processes, so the bottom of your ribs here, where they open, all the way down to pubis, where your rectus abdominis muscle run. You can first have a feel with your head down. See if you can feel any openings and gaps, although this might not be apparent when your head is down. Just feel of your belly. Then you can lift your head and come up. If you see a dome-shaped area, it is very likely, more than likely, that you have diastasis recti. For some other women, it might not be so apparent. So with one hand, you hold your head up, and with the other hand, you start to feel the area throughout the bottom part of your ribs to your pubis. What you are looking for is the width of the gap throughout, the depth of the gap, and here we are talking about 1 finger, 2 finger, 3 finger, and so forth. The depth, we're talking about phalanges, half of it, quarter of it, 1 or more. And how tight is the tissues between the gap? Are they really soft? Can you feel the movement of your gut maybe sometimes? Is there any lumps around your belly button? I also shall mention that if you just gave birth very recently, and you obviously will feel some gap, because up to 100% of women according to research, might develop diastasis, do not panic straight away. Give it a month and a half, and then you can do the assessment.